In an emergency caesarean section, the nurses, the doctors, they're just going to come running to you and say, we have to go now. They usually don't have time even just to sign a consent. You're given a verbal consent. So one of the main, or one of the reasons might be a cord prolapse, where the cord slips in front of the baby's head and comes down, and then when you're contracting and the baby's moving lower, the cord gets trapped between the bony pelvis and the bony hard skull of the baby, cutting off the blood supply to the baby. Sometimes this is found by when you're on the monitor. We see, a long deceleration. Sometimes the mom says, I feel something in the vagina, or sometimes it's found during an exam. And whoever finds it, if it's a nurse or a doctor or a midwife, whoever finds it and they feel that cord pulsing against their fingers, they have to stay there. And what they do is they push the baby up off the cord with their fingers. So they push the baby upwards just a little bit to relieve the pressure on the cord, and that's going to give the baby more oxygen and more nutrients for those few moments. And then whoever that is going to stay there while you're rushed to the operating room, and they don't move their hand away until your baby is lifted out through your abdomen. So it's an emergency. And remember, these obstetrical emergencies can happen to about 1% of all women, and we don't know who that is, and why one woman and not another. It doesn't necessarily mean that their health is, at any risk. It just is something that's happened right now. Placental abruption is another one. Sometimes, if you can imagine, here's the inside of the uterus and here's the placenta. And for some reason, the placenta decides that it wants to be born before the baby. So it peels itself off, sometimes just a little bit, sometimes it comes a lot, and then the placenta's kind of bleeding, and then you're bleeding, and both of you could be losing blood supply. So both of your lives are at risk. So it's an emergency C-section. There's no time, to discuss it and to think about it. It's nothing like that. Everyone's go, go, go. And this is where the nurses' voices might sound louder and more urgent, and that lovely soft kindness seems to be lacking. But this is where you go back to your breath and relaxing the muscles that you can relax and taking deep breaths into baby. Uterine rupture, very, very rare thing to happen. A mother who's a first-time mother like you, all of you, sometimes it can happen if you've already had a cesarean section or some kind of surgery on your uterus. Very rare though. But if it happens, of course, it's an immediate cesarean section. And then severe fetal distress. So remember, if your baby's heart rate drops down, we usually try to fix that by turning your body, repositioning you to relieve maybe pressure on the cord or placenta or whatever's being disturbed in there. If the movement doesn't work, we'll give you IV fluids, give you oxygen. If these measures don't work, and we've tried a few, maybe put you on your hands and knees with your head down and your bottom up to get the baby back out of the pelvis. If the baby's still having deceleration, we can't just watch that, because it's really hard on babies. Seeing the baby, say, with a heart rate 60 or lower, that's cardiac arrest. For us, that we know that the baby is not getting enough oxygen. So we want to get in there and get the baby out of your body so that we can resuscitate the baby. So it's an obstetrical emergency. So we're all go, 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 go. And we're doing exactly what you would want us to save your baby, okay? So if you see that, if you hear those words, just take your deep breaths, relax your face, allow that oxygen to find its way to baby. The good news is it only happens 1% of babies. But you want to be somewhere safe if it's you.